Good morning, my dear students, to my fellow instructors, and to our very able college administrator. I am Marie Cecil Liberty Varela, and it is my pleasure to be your moderator for our first ever webinar on infection prevention and control. As the World Health Organization declared the 2019 coronavirus disease as a global health crisis, which led to the disruption of almost everything. Some work has been stopped, classes are suspended, as everyone are advised to stay in the protection of their homes. Although flexible learning has been the best choice, face-to-face delivery for some courses is still necessary, especially health-related courses as they are trained to handle lives. In connection to this event, the need for the institution to plan measures to prevent our students, faculty, and staff from getting infected from the disease and other infectious diseases is a must. We are thankful of today as we are to take another step on safeguarding everyone, especially you, my dear students, who will be coming back to school as classes resumes through face-to-face modality. A friendly reminder to all our participants. Those who will be joining via Google Meet, please turn off your microphone while we are having our lectures. For those who will be joining via Facebook Live, we advise everyone to mention or comment your name, year, and section for monitoring. You can also take post, selfie, or a screenshot and post it in your social media accounts and use the following hashtags. Hashtag GoComadrona, hashtag ISCCHSD Infection Control 2022, and ICC Arises. Please reserve your queries and clarifications at the end of the lecture series for the open forum. To start the program, we ask the blessing and presence of the Almighty Father, followed by the singing of the Philippine National Anthem.
Our Heavenly Father, Almighty and Lord over all creation, we thank you for the blessings of life and love you give, and for the opportunity that is in front of us today. We thank you for keeping us safe amidst the troubling times. Today, we pray that you guide us, that we may be able to do our best to learn from all the knowledge and experiences that the instructors would impart. As we seek to improve ourselves, we pray that you help us see the connections of the lessons to our duties and responsibilities to maximize its benefits in its application to the delivery of our service. We pray that by your holy wisdom, we would be able to apply these things for the betterment of the quality of life for today's and future generation. We pray that you let us be open with our thoughts, that we may be a blessing to others. May we be able to exercise the gifts you have given to form camaraderie, for us to be able to successfully finish every challenge that would be given our way. Lord, please protect us and our families from the pandemic and from any distractions, for us to be able to focus solely on the lessons for the day. We thank you and trust you with all our heart. Amen.
Pelas ng sinangalan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, luyang ka ng magiting, sa manlulupi, di ka masisiling, sa dagatan mundo, sa sipay at sa langit mong butang, may nilagang mula namin sa paglayang pinamahal. Ang isat ng matawad mo'y nagbukay na naninilig. Ang bituin at araw ng kailan ay manililig. Lupa ng araw na wala ikaw sito, buhay namin sa piling mo. Ang ligaya naman may angati, ang mga day ng dahil sa'yo.
Magandang araw.
Good morning, my dear students. Good morning, my dear students. Head Mr. Limwell Delorico for his opening remarks. Let us give him a virtual round of applause. Thank you, Sir Limwell, for that very warm welcome.
In behalf of Sir Limwell, may we ask Sir Jerly Reduble for the opening remarks.
Thank you very much, Ma'am Ceci. So to our college administrator, Dr. Arnel Castro Doctolero, our resource speaker, Dr. Jeffley Reboron, to our student development coordinator, Sir Berkian Pograd, fellow educators, my dear students, a pleasant afternoon. The COVID-19 has been the center of attention because of its multidimensional impact to our lives. Generally, our quality and ways of life has been greatly affected, and to students, because of the pandemic, they fail to enjoy the experience of going to school, mingle with their friends, roam around to unwind, and other enjoyable moments of being a student. With the initiative of the Commission on Higher Education, The opening of the limited face-to-face can be a glimpse of what we are doing to overcome the effect of this pandemic. However, we are also facing the threat and risk of getting the infected that we generally jeopardize our safety. The conduct of this webinar orientation about infection control and prevention will play a significant role to protect ourselves and to the people we serve while we pursue for knowledge. With this in mind, I am encouraging the participants of this webinar to listen attentively and learn it in by heart. I hope you find value in this webinar, and we hope that with our concerted efforts, we may dispel whatever misinformation there is in our community, and hopefully, once and for all, put an end to this global health predicament. The first step to solving this plight is to get informed. And so, may this be a day of learning, of thriving in the new normal. Without much ado, I welcome you to this webinar orientation activity. Good day and keep safe, everyone.
For everyone, especially to the people in the healthcare team. Infection prevention and control, especially to the country, and has been a big challenge for everyone, especially to the people in the healthcare team. Infection prevention and control is one of the most important concepts of health crisis, like what our experience. May I call to the virtual space Mr. Paul Mark Pilar, the Assistant Department Head for the Health Science Department. Let us give him a virtual round of applause.
A pleasant afternoon to everyone. Our resource speaker for this afternoon hails from Poblacion Santo Domingo, Ilocos Sur. He is a graduate of Diploma in Midwifery and a Bachelor of Science in Nursing from the University of Northern Philippines. A year after graduating from his baccalaureate degree, he decided to enroll in the graduate school and graduated from the degree Master of Arts in Nursing, major in Maternal and Child Nursing from the same university in 2010. In his quest to further his craft and his innate love for learning, he enrolled and graduated Doctor of Philosophy in Nursing program from the St. Louis University in Baguio City last 2017. Currently, he is taking up his doctorate degree in education at the University of Northern Philippines. Due to his perseverance, experience, and expertise, he was designated as the research coordinator of our institution. Immediately after assuming office, he has coordinated various activities and programs that have stayed true to the goals and objectives of his office and institution. He has conducted research and participated and presented in various research conferences and has also attended various trainings and seminars to further improve his craft and is an active member of various professional organizations. Ladies and gentlemen, without further ado, let us welcome our resource speaker with a virtual round of applause, Mr. Jeffley Reboron.
Magandang araw po sa inyong lahat, and I hope that you are all safe and sound wherever you are right now. Before we start, I would like to thank Ilocos Sur Community College Crisis Management Committee for having me as your resource speaker in today's orientation. My name is Dr. Jeffley Reboron, and I am tasked to give you a quick orientation on the COVID-19 infection control and prevention processes, along with the rational use of personal protective equipment. This brief webinar will not only prepare you to transition to the new normal, but it is also needed for our application for the limited face-to-face and for your future clinical duty. And after this webinar, we hope that this orientation will prepare you to feel more safe and secure in protecting yourselves and your loved ones during these dark times. Before we begin, let us look at the different goals and learning objectives of today's session. The overall aim of this orientation is to increase your awareness on health and safety measures regarding COVID-19 in preparation for your limited face-to-face classes, clinical duties, and on-the-job training. Specifically, for this session, we want you to learn about the basic facts on COVID-19 and SARS-CoV-2 virus, and we also envision for you to understand the different strategies on how you can protect yourself and other people from the infection. We also envision for you to comprehend the precautionary protocols to prevent, control, and contain the pandemic, and be familiarized with the different personal protective equipment and infection control and prevention strategies across settings. So listen intently because we have a lot in store for you. Before we begin, let me present to you my disclaimer for this orientation. First is that I am in no way, shape, or form an expert on COVID-19, and the topics that I will be presenting are heavily influenced by research, mainly from the Department of Health Academy. I also claim no ownership of the materials, videos, and other resources used in this ICP orientation, and I also have no conflict of interest in serving as your speaker for this COVID-19 orientation. In the context of COVID-19, you have to remember that it is important to stay in touch with rapidly changing knowledge and situations regarding this pandemic. And it is also vital for you to rely on factual resources and sources of information and not primarily on social media sites. We have also to remember that we are men and women of science if you are enrolled in the college level, and we should not immediately believe on things that we see or hear online. Always remember that it is easy to create posts and spread fake news, so please validate and verify everything you see before reposting it on your wall, especially if it is with regards to COVID-19. If there is one thing more dangerous than being uninformed, it is being misinformed. So always think before you click, especially when it comes to COVID-19 data. Now, let us first define what Infection Prevention and Control, or IPC, means. When we talk about IPC, it is a key component of understanding and managing any pandemic such as the COVID-19. And it is imperative or important for healthcare professionals and people in the community to understand the importance of these infection prevention and control measures, what they are, and how they can be effectively implemented. But before we go any further, let us zero in and focus on the basic information about the COVID-19 pandemic. We will be watching a short video from the Department of Health, the World Health Organization, UNICEF, and USAID to understand how the pandemic began, how we can hope to protect ourselves and our family from the virus, and hopefully how we can put an end to this pandemic in the coming years.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, Coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice.
And the CDC websites. However, there are many reports now of other symptoms which are called non-specific, meaning they are not exclusive to COVID-19, among these being headaches and loss of taste and smell, which in many case reports is an early clinical symptom. Many patients also succumb from acute respiratory distress syndrome. There are reports of gastrointestinal symptoms like diarrhea and vomiting, and sometimes it can present itself as cardiac disease, cardiac myocarditis, rashes, or even disorientation or neurologic symptoms, as well as just fever with chills and generalized myalgia or muscle pain, or just feeling really terrible, like a typical viral or flu illness. What's just as important to know or be aware of in our discussion of infection prevention and control is the possibility that there are COVID-19 patients who are asymptomatic. How large the percent of asymptomatic COVID patients is still not known, but this is important for IPC considerations, since there may be persons who are walking around without symptoms, who can still become a source of viral transmission. Also important in terms of IPC prevention and control of COVID-19 is the combination of circumstances associated with outbreaks. The combination of factors which pose higher risks for COVID-19 outbreaks can best be remembered by the 3 C's. The first C is closed spaces with insufficient ventilation. The second C is conversations in short distance, for example, less than 1 meter away. And the third C is crowded conditions with people. So what are the classic examples of these 3 C's? You may be aware of the cruise ship that had 600 cases. Second would be outbreaks in prisons reported in the Philippines. And lastly, the spikes in cases in Singapore from worker dormitories. All these fulfill the 3 C's, and the 3 C's remind us of what we need to avoid or correct in order to prevent and control the spread of COVID-19. It's very important to know how COVID-19 is transmitted. As seen in the video, it's largely transmitted by droplet and contact. Now, what is a droplet? These are liquids or secretions released in the air when a person infected with COVID-19 coughs or sneezes. It travels for about 1 meter in the air and can land directly on your nose or your mouth, which can serve as the portal of entry of SARS coronavirus 2 into the body. It can further be inhaled to reach the lungs and then onto other organs of the body. The other way that COVID-19 is spread is through contact. When the droplet doesn't land on the mucous membrane-lined openings of the face, it can land on surfaces or objects. The virus is known to survive for a number of hours or days, depending on the surface that it lands on. When our fingers touch these objects or surfaces, and then we touch our faces, an action we often do unconsciously, then transmit the droplets containing the virus to our nose, mouth, and even the eyes. These are the major ways that COVID-19 is spread, and therefore the IPC measures that we will discuss shall be vital in cutting this chain of transmission. This disease is highly transmissible. One person can infect 2 to 3 others more, and then those 2 to 3 others can then go on and infect 2 to 3 others more if none of the IPC measures are practiced.
What you just saw is a video about the COVID-19 pandemic from the Department of Health, World Health Organization, UNICEF, and USAID. Now we are ready to understand more about the disease so that we can better break the spread of the virus and protect ourselves and our family members. Because SARS-CoV-2 is a new virus, information is almost always changing on a daily basis. We hear it on the radio, we see it on the news that there is a new strain of this virus spreading across our community. And it is always important to check credible and reliable sources of information to make sure that the knowledge that we have about the virus is current and up to date. We have to remember that the virus is ever changing, it is mutating, and each period the virus can evolve into another strain. This means that the practices and protocols that we followed during the start of the pandemic season may have already changed in response to this new variant or to this new strain. We should remain vigilant and abreast with the changes in the IATF protocols so that we can better protect ourselves and our community. Again, I cannot stress how important it is to share and believe only reliable and credible sources. When it comes to COVID-19, be sure to validate information before spreading it. When we speak of pandemic, it is defined as a disease or condition that is prevalent over a whole country or the whole world. And COVID-19 has been declared as a global pandemic last March 11, 2020 by the World Health Organization because that disease did not just occur on isolated parts of China, but it has included majority of the countries around the world. We have to remember that COVID-19 is highly contagious and it can easily spread from one person to another in just a matter of days. It is especially dangerous to older patients with comorbidities or yung mga added sickness ng mga matatanda. New variants of this virus are emerging because it is also evolving every single day. Now, we have a new, scarier, and more deadly and more contagious variants of the COVID-19 virus, which we call the Delta variant, which is the B16172, and of course the Omicron variant made popular by Poblacion Girl, which comes at the nomenclature B1.1.529. Now, scientists are saying that COVID-19 is here to stay, and that all we can do is to simply learn to live with it by following guidelines of the new normal. Marahil nagtataka yung ilan sa inyo what the difference between SARS-CoV-2 and COVID-19 is. Let me explain. The virus that is causing COVID-19 is what we call SARS-CoV-2. Simply put, when we speak of SARS-CoV-2, we are referring to the virus, and when we speak of the disease or the coronavirus disease 2019, we refer to it as COVID-19. So don't be confused. When we speak of COVID-19, we are referring to the sakit or to the respiratory disease. And we speak of the SARS-CoV-2, we are referring to the virus. Now, let's focus on SARS-CoV-2. You have to remember that SARS-CoV-2 is a novel strain, meaning it is a new strain of coronavirus. And dahil sa bagong-bago nga ang ating SARS-CoV-2, humans like us have not yet developed the immunity against COVID-19. And therefore, we can be infected by SARS-CoV-2 and we can develop the COVID-19. Okay? Now, how do we become immune to the virus? Paano natin malabanan yung virus na to? We have two ways of getting immunity from this disease. Number one is that we can expose ourselves to this virus, and after we survive the COVID-19, we are already immune to SARS-CoV-2. The other way is having ourselves vaccinated, because when you vaccinate against that virus, you are prevented from contracting that disease. So, ibig sabihin nito, when we are exposed to the virus or when we have ourselves inoculated, ibig sabihin that we are already developing our immunity against SARS-CoV-2. However, just because you have been inoculated or vaccinated against COVID-19 or against SARS-CoV-2, or just because you have already experienced having COVID-19, doesn't mean that you will not be infected again. Okay? You have to remember that the virus is evolving and it is ever changing. And as long as there is a new variant of the virus, as long as there is a new strain of the virus, you can expect that you can become reinfected over and over again, especially if you do not follow health protocols and health and safety guidelines. So, laging tatandaan, kahit na kayo ay nagkasakit na ng COVID-19 or kahit kayo ay nakukumpleto na ng inyong second dose of the COVID-19 vaccine, doesn't mean that you will not be infected anymore. Hindi po totoo yan because we have new strains of this virus as the day progresses. So you should still follow health protocols and health and safety guidelines. Now, the symptoms of COVID-19 may appear after 2 to 14 days after your initial exposure. Kapag meron kang nakasalamuhang tao na carrier ng COVID-19 or ng SARS-CoV-2, I should say, you can expect that the signs and symptoms of the respiratory disease will appear after 2 to 14 days. The problem with COVID-19 is that it has clinical manifestations or signs and symptoms that may easily be mistaken as a common cough and colds or seasonal flu or trangkaso. Ang problema kasi sa COVID-19 ay pareho sila ng mga signs and symptoms sa mga common diseases na na-experience natin on a regular basis. The most common symptoms of COVID-19 infection can include fever. It can also include cough and shortness of breath. And most lay people, yung mga people who are not under the medical field, or individuals who are not really expert when it comes to health may assume that their respiratory symptoms are not COVID, but they are trangkaso or ubot-sipon lang na simple, and that they are not taking these signs and symptoms seriously already. There are also different patients who report other symptoms of COVID-19, which can include sore throat, runny or stuffy nose, body aches, headaches, chills, fatigues, gastrointestinal diarrhea, and loss of smell. So as you can see, we have different signs and symptoms of COVID-19, and we can easily mistake them for other diseases na mas common or na hindi masyadong malala. And the problem with not considering yourself infected with COVID-19 and just saying, trangkaso lang detoy, uyek panating lang detoy, is that you're exposing not just yourself, but other people in unnecessary danger. So what I'm trying to say, we should always remember that if we already have these symptoms, it is best to isolate and have yourself tested and consult a medical practitioner. Mas maaga po ang maagap at mas maganda po that we are able to detect and isolate yourself, detect the virus kung kayo ay nakaka-feel na po ng mga ganitong signs and symptoms. Supposing you are already experiencing these signs and symptoms na pinag-usapan natin on COVID-19, what are you gonna do? For most healthy people who have COVID-19, the illness will be mild and you can simply recover at home by drinking lots of fluids and using over-the-counter medications for your signs and symptoms. For example, paracetamol for fever. You should also start separating yourself from other people at home and practice good personal and environmental hygiene. Gusto kong i-reiterate that when you develop the mentioned COVID-19 signs and symptoms, you may start already isolating yourself from your family members so that we can prevent the spread of the virus. Huwag niyo pong iisipin na, ay, wala pa naman akong antigen test result, hindi pa naman ako nasa swab, kaya hindi muna ako mag-isolate. That is not a good practice. We need to remember that as long as we see these signs and symptoms, we already should start isolating ourselves so that in the event that we have this COVID-19 disease, we prevent it from spreading to our family members. We have to remember that there is no cause for panic. We remember that the disease is self-limiting and it may be treated at home as long as you remain healthy. If you and your family members suspect that you have contracted the virus, and if you have already noticed the signs and symptoms, it is best that you call or you message your rural health units or hospitals or COVID-19 facilities that are near you. Okay? Kontakin nyo na po sila, tawagan nyo na po sila that you are experiencing these signs and symptoms. Do not just go to these hospitals without calling first. Hindi po maganda na agad-agad pumupunta tayo sa mga hospital na ito. Bakit? We want to stay away from emergency rooms, hospitals, and family doctors if we have these diseases to avoid spreading SARS-CoV-2 to other people. The last thing we need to do or we want to do is to infect our medical frontliners. So, if you feel these signs and symptoms, huwag agad pupunta sa mga hospital. Instead, mag-isolate, drink lots of fluids, and take over-the-counter medications for your signs and symptoms. And you call your RHU, your doctors, and your hospitals or COVID facilities near you, and then report yourself that you are experiencing the signs and symptoms para ma-advisean po nila kayo kung ano ang gagawin. Do not immediately go to these facilities because we do not want to infect or contaminate these medical frontliners. However, if you are generally unhealthy or if you have comorbidities or mga ibang sakit bukod sa COVID-19, it is best that you isolate yourself and you manage yourself at home, but you have to monitor yourself and look for danger signs of COVID-19. You have to remember na Hindi dahil sa sinabi natin that COVID-19 can be managed at home, is that you can treat yourself inside your homes kahit na meron na kayong malalang sakit. You look for difficulty of breathing or shortness of breath, and you also monitor yourself for any persistent pain or pressure on the chest. Or you also notice your family members if they are developing new confusion or inability to arouse or narigat na nga maririingin if they have COVID-19. Or you also look for bluish lips or bluish face. Pag nakakita na po kayo ng mga ganitong danger signs sa mga patients natin na may COVID-19 who are treated at home, immediately contact your doctor because you might need hospitalization. Bakit? Because for patients who are manifesting these signs and symptoms na sinabi ko kanina, including difficulty of breathing and shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish discoloration on the face and lips, pag nakikita natin yung mga signs and symptoms na to, this may mean that they may need oxygen rescue or intubation. Baka kailangan po nilang matubo kasi nahihirapan na silang huminga because of COVID-19 disease. So, once you see these danger signs on yourself or on your family members who are suspected to have COVID-19, immediately call for medical attention. Again, do not immediately go to these facilities. You have to call them first so that you are advised properly on what to do. While we are on the subject of people with signs and symptoms of COVID-19, I think it is also best that we also learn about several terminologies that may be used to describe these persons. We have to remember that the Commission on Disease Control uses the term person under investigation or PUI for a suspected case. And how do we categorize if a person is suspected or PUI? Masasabi po natin na a person is under investigation or a suspected case if they have clinical criteria which include cough, fever, and shortness of breath, and also along with any of the risk factors. So yung PUI po, meron siyang signs and symptoms that include either cough, fever, and shortness of breath, or maaari din siya ay contact patient who has contacted patient known to be suspected or to have COVID-19, or meron siyang history of exposure with a confirmed case or a probable case of COVID-19, or siya ay nagtatrabaho sa isang healthcare facility that are taking care of COVID-19 patients, or kung yung tao na yon ay nag-travel sa isang lugar kung merong mataas na kaso ng COVID-19, or if they are directly handling bats or non-human primates from disease areas. So those are the risk factors that we can also consider when we categorize a person with who are under investigation. I repeat, yung isang PUI po or person under investigation ay dapat meron siyang clinical criteria which includes cough, fever, and shortness of breath, or meron siyang risk factors within the past 14 days. And yung mga risk factors na yun is number 1, meron siyang contact, direct contact to a patient with known or suspected COVID-19, or meron siyang history of exposure sa isang tao who is a confirmed or a probable case of COVID-19, or if that person is working in a healthcare facility taking care of COVID-19 patients, or kung siya ay merong travel history sa isang area where there is known COVID-19 transmission which is active, or if the person has direct handling of bats and non-human primates from disease areas. Matatawag naman po natin na yung isang tao ay PUM or person under monitoring if the person is not showing any coronavirus symptoms but has a travel history to areas with issued travel restrictions or history of exposure to the novel virus. Ibig sabihin po dito, yung isang tao ay meron siyang past history for the past 14 days sa mga nabanggit natin na risk factors, but that person has no signs and symptoms, meaning nag-travel lang siya sa isang lugar wherein meron na issue na travel restriction. So those are the difference between PUI and PUM. But as of the moment, the Department of Health has updated the use of these terminologies in describing COVID-19 patients. Now, if that person under investigation or person under monitoring have already been tested for COVID-19 and they turn out to be positive, they can already be called the confirmed COVID case. Ang lagi niyong tatandaan po that we need laboratory tests to determine if a person really is positive of COVID-19. So kailangan po natin ng laboratory test na ginagawa sa mga suspected and people under investigation para po malaman na sila ay talagang merong COVID-19. Now, as of the moment, the gold standard for determining the presence of COVID-19 is through what we call the real-time reverse transcriptase or the RT-PCR test. Ito po yung ginagamit natin na confirmatory diagnosis that tells us that indeed, pag nag-positive yung tao na yon na RT-PCR, ibig sabihin is that there is an active COVID infection. Dito po sa atin, tinatawag natin na swab test, yung RT-PCR test na yon. Again, that is the gold standard and confirmatory diagnosis for an active COVID infection. So marahil nagtataka kayo what is the other test na ginagawa nila, which they call the rapid antigen test or the RAT test nga po nada. The antigen test, or what we usually know as the rapid tests, will usually have a rapid or quick results. Ito po yung mga ginagawa natin sa borders, ginagawa natin sa bahay. However, they are not as accurate as the RT-PCR test because they require more of the virus in the sample to report a positive result. Ibig sabihin nito, ire-report lang ng rapid antigen test mo na positive yung isang tao pag sobrang dami ng virus na yon ang kanyang na-detect. Meaning, pag konti lang yung na-detect na virus ng rapid antigen test mo, it might give you a false negative result. Ibig sabihin, merong COVID-19 yung patient, pero nag-test ka ng rapid antigen test, ang lumabas po ay negative. So ibig sabihin, yung pasyente meron siyang COVID pero ang lumalabas sa antigen niya ay negative. So that is one of the dangers of using the rapid antigen test because it is not 100% accurate. So anong nangyayari pag merong false negative yung mga lumalabas na sa mga patients natin? A false negative test will show that a person is negative even though that person really has COVID-19. So what happens? Yung tao na yon na merong COVID-19 pero sa rapid antigen test niya ay negative naman, lumalabas siya. At siya yung nagiging reason kung bakit merong spread of the virus, the SARS-CoV-2. So like again, the gold standard, what I'm trying to say is that the gold standard for confirming COVID-19 is always the RT-PCR test, hindi po yung ating mga antigen test. Just because nag-negative ka sa rapid test mo, rapid antigen test mo, ibig sabihin wala ka ng COVID. You also have to subject yourself to RT-PCR test to confirm that you really have COVID-19. So yun po yung difference ng RT-PCR test and the rapid antigen test. Marahil, marami sa inyo ang nagtataka kung bakit sobrang big deal ng COVID-19 na nakakaya naman pala siya ng home remedy. Well, you have to remember that indeed, tama kayo, COVID-19 is self-limiting, especially to healthy individuals. So it shouldn't be a big deal, tama ba? Kung malakas ka, makakaya at makakaya ng katawan mo na labanan yung virus. But the problem with that concept is that not all of us are healthy and not all of us have strong immune systems. You have to remember that there are individuals within your family, within your community, within your social circles that are not as strong and as resilient and as healthy as you. Sila yung mga taong may heart diseases, lung diseases, diabetes, or sila yung mga immunocompromised or mahina ang immune system. Even if you are healthy, you have to take into consideration that there are people around you who are already old, who are still very young, and these people do not have the immunity that you have. And that if they get sick, they may get very sick. Or worse, they can even die. I guess what I'm trying to say is that if you notice a sign or a symptom related to COVID-19, you have to be responsible enough to start isolating yourself and report yourself to the nearest healthcare facility for you to be tested. There are people who do not want to get themselves tested because they think that what they have is just the seasonal flu or what we call trangkaso. Indeed, COVID-19 and the seasonal flu share similar symptoms, but the coronavirus is a unique virus with unique characteristics. Now, pag-usapan natin the similarities between SARS-CoV-2, which is the cause of COVID-19, and the influenza virus, which causes your usual flu or your trangkaso. First, they are similar. SARS-CoV-2 and influenza virus are similar because they have similar disease presentation, meaning both of these viruses can cause respiratory disease, and they both start with either a cough or a cold and then a fever. Secondly, both of these viruses are transmitted by contact with nasopharyngeal secretions or yung mga secretions natin coming from the mouth and the nose. Droplet infection or yung mga naibubuga natin pag tayo ay nagsasalita, nakikipag-usap, humahatching or umuubo, those are what we call droplets. And fomites or contaminated equipment or surfaces. Both COVID-19 and flu may be transmitted through oropharyngeal secretions or droplets, and that both of them can be prevented using hand hygiene, good respiratory etiquette, or example of that is coughing in your elbow, or using a tissue immediately and then disposing of it, and then isolation. So meron silang pagkakapareho. And we will also dive into the infection control and prevention of both COVID-19 and the seasonal flu as we go along our discussion. So, tama po kayo. Pareho yung mga presenting signs and symptoms of the seasonal flu and COVID-19. Pero paano natin malalaman kung kayo ay may seasonal flu or COVID-19? You have to get tested. Yaman din lamang na napag-uusapan na natin ang trangkaso, I know that some of you may have already heard other people saying that COVID-19 is just as harmless as the seasonal flu. People will say, trangkaso lang yan, trangkaso la deta, iinomam lang ti ara. Mali po yun. To say that COVID-19 is just as harmless as the seasonal flu is a grave understatement. According to research studies, the case fatality rate of COVID-19 is about 2%. Meaning, 2 out of 100 people who get infected from COVID-19 will die. 2 over 100 people who are infected of COVID-19 ay maaari pong mamatay. Now, let us look at the seasonal flu and its case fatality. The case fatality rate of the seasonal flu is just 0.1%. Ibig sabihin, sa 100 na tao na nagkakasakit ng trangkaso, halos wala sa kanila or 0.1% ang namamatay. When we look at the mathematics deeper, this only means that COVID-19 is 20 times more deadly than your seasonal flu. Aside from that, research studies also suggest that 15 to 20% of people may develop severe respiratory symptoms when they are infected of COVID-19. Ang ibig sabihin po nito, sa kada 100 na tao na nagkakasakit ng COVID-19, 20 or 20 sa kanila ang mangangailangan ng hospitalization or kailangang matubuhan dahil mahihirapan silang huminga, nagkaka-pneumonia sila, or bababa yung kanilang oxygen sa kanilang dugo. Ibig sabihin, 15 to 20% of people who experience COVID may need hospitalization. Wala ding lunas ang COVID-19. Most of the drugs being given to patients are still under experimentation. And even though we already have vaccines, we do not know how long these vaccines can protect us, especially so that the virus is mutating. So, lagi niyong tatandaan po that COVID-19 is 20 times more dangerous than your seasonal flu and that we have to take it seriously. Now that we have already understood what COVID-19 is and how dangerous it can be, let us now learn the different precautionary measures that we can employ to prevent the spread of the virus and to protect ourselves and our loved ones from the wrath of the pandemic. Our topic for this next module is general or standard precautions against COVID-19. This will include hand hygiene, physical distancing, and respiratory hygiene. These are standard health precautions and that should be practiced in the home, in public places, and healthcare facilities. In other words, wherever you are, you need to follow all of these COVID-19 precautionary measures. Again, all of the information that I will be sharing to you in this module comes from the Department of Health, the World Health Organization, UNICEF, and USAID. Let's start. As individuals in our community, you have a role to play in preventing the spread of COVID-19. Let us have a general overview of the things that we need to prevent the spread of COVID-19. After a general briefing of the standard health and safety practices against COVID-19, we will focus on the precautionary practices individually. Now, what do we need to do to curtail or to stop the spread of the pandemic? Number one is that we have to be informed and we have to be prepared. Like I said a while ago, you have to base your information on sources that are credible and trustworthy. Ang isang problema kasi sa atin is that we believe everything that we see online. And the best way for us to stop this pandemic is that we should remain informed and up to date with the newest updates regarding the curtailing and prevention of the spread of COVID-19. Aside from that, very simple, we also have to wear a mask. Alam natin that COVID-19 can be spread using nasopharyngeal secretions, droplets, contacts with fomites. So, ang kailangan natin gawin is that we prevent ourselves from harboring this causative agent by simply wearing a mask. Aside from that, we have to maintain social distancing of at least 6 feet kung maaari, so that in the event that a person without a mask coughs, ay hindi tayo matatamaan ng mga droplet na yon. We should also wash our hands frequently with soap and water. And if we do not have soap and water as of the moment, we can also use alcohol-based hand sanitizers. And we also have to avoid touching our eyes, our nose, and our mouth because those are portals of entry of the microorganism. You have to remember that the virus can live up to the surfaces for a number of hours. So kunwari, merong microorganism sa ballpen na ginamit ng isang COVID-19 positive na patient at hinawakan mo yung ballpen na yon, and you also, after using that ballpen, touched your mouth, your eyes, or your nose, you can be introducing that causative agent, the SARS-CoV-2, into your body.